Morning, everyone. There you go. Now I know people are in the room. I'm Will Francis. I'm the Executive Director of the Texas and Louisiana chapters of NASW. It is my esteemed honor to be hosting this panel. Could I have our panelists come up? And we will sit down and we will begin a bit of a discussion and a little bit of background about the work groups themselves. Yeah, perfect. I have slides. I first would like to say, as our amazing panel comes up, please give a big round of applause for Seth Winnick again. We have some amazing sponsors. Hogg and Methodist Healthcare Ministries are so generous with their resources and support, but it takes people to make things happen. And Seth and his team, he led the steering committee. He and Meg worked very closely on this. Huge, huge thanks to them. So what we're going to do this morning here, just to kick it off, is start with a little bit about what the Coalition of Healthy Minds is. We are really built upon the work of our members. We do not sit in a room and think this is the best thing for behavioral health in Texas. We really work to bring as many voices into the conversation as possible, and our work groups really epitomize that structure. They're built up of members and non-members, folks who believe in what behavioral health means and how we can use the transformative power of our legislature, the funding of our budget, resources out in the communities, grassroots efforts, peer support specialists, professionals, those with lived experience. All folks have a place in this conversation. So I'm just going to start off, and I'm just going to go down the table here and give each of our members a little bit of a chance to just describe what their work group is, some of the work they're working on, and what their focus is. And then after that, I'll throw some questions at them, and we'll start there. So Angela, if you'd like to begin.
Cool. Can y'all hear me? Is that, okay, cool. I can never tell if it's on. Hey everyone, my name is Angela Ott. I'm a policy specialist at Disability Rights Texas, and I co-chair the Institutional Rights and Civil Liberties Work Group with Lisette Galvan, who is with NAMI Texas. She's back there. We span quite a wide berth of policy issues. You will see if you attend our panel that we'll have people working at the intersections of behavioral health and juvenile justice, the criminal justice system, people with intellectual and developmental disabilities, judicial system, state hospitals, goes on and on. So with our drivers, I'll go into it like really briefly, but I don't want to go too, Come
to the session this afternoon for the
cool.
details.
Yeah, you can get more, if you come, I have candy, then you can come and hear more about it. So we really focused on continuity of care with our drivers. So as you will see, if someone's in an institution, for whatever reason, maybe it's carceral, maybe it's a state hospital, private psychiatric facility, SSLC, their lives are disrupted. And so when they're going back into the community, especially if they're in a jail or prison, they might lose access to Medicaid. They might lose their Medicaid waiver slot. So our two drivers are jail continuity of care liaisons, and then the OBI pilot, which is outpatient biopsychosocial pilot for people with a dual diagnosis of a mental illness and IDD. You can hear more about that, and I will not take up too much time, but we're a great group, and we've got some amazing panelists today in our breakout session.
Fantastic. And your group has sort of reformed since earlier on in the coalition, right? We've sort of come up to this, really finding that this committee is super valuable within the space.
Absolutely, yes. It's definitely been a growing period for our group, and also if you would like to join, we'll take you. We've had a great time getting to know everybody, and I will happily bug you and send very detailed emails with a lot of bolded action items and highlighted. So feel free to join. We'd love to have you.
You may notice a theme today that we're going to ask you a lot to work for free for us, because that's very important. But the reality is, and it's very, very true, you can go faster alone and further together, and we really believe that together is how we're going to be able to change Texas. Next, we have Anna O'Quinn.
Hi, y'all. I'm Anna. I'm the Changemaking and Advocacy Manager at Girls Empowerment Network, and I get to co-chair the youth work group. I like to say we're the most fun work group because we work with youth. That's not a dig at the other work groups, though. They're all wonderful, but we do get to talk about youth, which is fun. So this session, we're really focusing on a two-prong approach, both on schools and communities, and specifically focusing on school-community partnerships. Really looking at, a lot of y'all are familiar with MTSS, multi-tiered system of support. We're looking for tier 1. run of that level to support students. And so that's things like social and emotional skill lessons, bullying and violence prevention programs, suicide prevention programs. And we really know that if we support the comprehensive continuum care like that, we'll improve student academic and social outcomes, and then we're also going to prevent them from reaching that crisis level that none of us want them to reach, right? And so we really are looking at increasing resources to communities, increasing resources to schools, and then that will help pave the way for these really unique school-community partnerships that'll support prevention, early intervention, and will also keep youth in their communities and in their families. So specifically, if you're curious about what that looks like legislatively, we're looking at the Smart Innovation Program. If any of you worked on SB 26 last session, we want to expand that this session. Also looking to dedicating resources to schools specifically. So there's a whole host of ways we can do that, and all of you can support with that. Funding and supporting a mental health allotment, increasing HHSC prevention programs, federal support, and then also increasing those really amazing at-risk school and student programs like CIS and OST. We have also a really, really amazing panel. We're really focusing on what Dr. Martinez was focusing on or talking about earlier with lived experience. And so on every single panel, we're gonna have a youth perspective, which we're excited about, a guardian perspective, and a provider perspective. And we'll talk about what happens when we do support students at that preventative mental health care level, and then maybe what happens when we miss the mark there. So we're excited to see you all there.
Awesome, thank you. And I just so appreciate how you all center the youth and all the work that you do. You understand sometimes the sports are in that wraparound space, but at every turn with this committee, it's about where is that youth voice, not just on what is best for the youth, but what they feel that is most needed from a resource perspective. And thank you for that. Next, we have Allison Moore-Boulware.
Hey, so my name is Allison Moore-Boulware. I'm the Director of Policy at the Haag Foundation for Mental Health, and I'm also one of the co-chairs for the Behavioral Health Capacity Work Group. The other co-chair is Brian Modest with the National Association of Social Workers Texas, who's unable to be here today, so I'm flying solo with Will and helping me in our breakouts, as well as Nicole Malone, the policy fellow. So our work group actually started as the telehealth and telemedicine work group during the pandemic. After we had some success in the 2021 session with changing some telehealth and telemedicine rules, we reconvened and decided that we needed to focus more on more broad behavioral health workforce challenges. So we broadened our group's capacity, and also, as you can imagine, had to put up some guardrails, right? Because every provider group, every type of licensee, certification has their own priorities. So what we really started with is, hey y'all, what can we do that there is consensus for, that will support the entire spectrum, that will support peers, that will support licensed folks without creating any division between? So we have really narrowed our work group so that we can have that consensus. And what that means for us is building on what happened and started last session that we really saw some momentum for. So we have two drivers this session. The first is a legislative driver to fund a behavioral health innovation grant program through Article 3. It was created through House Bill 400 last session, but was not funded in the budget. So it's an easy win, right? Wink, wink. All we have to do is fund it for $20 million. And that's budget dust. But the great thing about that program is that it's for any type of behavioral health provider. Recovery coaches, peer support specialists, certified family partners, the entire spectrum up through psychiatrists and psychologists. And each health institution would be able to create their own program that their region needs and wants, and apply for funding through that program. So again, it is a budget driver. Our legislative driver is to allow master's level providers to bill for Medicaid counseling. We'll go through that more in our breakout, but essentially this bill last session got really far, and it's already been filed for 3 or 4 sessions. So come on, we can do it this time. We can get it past that finish line and to the governor's desk. And we know that this will really impact the Medicaid provider networks. So we'll go through it more in our breakout room, but that's what our group is working on. Thanks.
Thank you. And the challenges you all have of keeping it away from scope and back to the issues is absolutely amazing. And now, ending our trend of A speakers, but staying in the vowels, we have Elizabeth Henry, who's going to be sharing next.
Hi, I'm Elizabeth Henry. I'm the Director of Policy with Recovery People and past chair for the Substance Use Disorder Work Group. We like to say, I think a lot of people sometimes consider mental health like a blanket term to be inclusive of substance use, and I would like to state for the record, they are not one and the same. While they do have some overlap, there are some very substantial differences between the two. They are uniquely special and both deserve their own work. So our work group primarily is focused on lowering barriers, funding. We always need more money. There's never enough, so money. However, looking at lowering barriers, access to quality support services, we run the gamut in our work group from prevention, early intervention, harm reduction, treatment, and recovery. So we are hitting the entire spectrum and ecosystem of substance use, not just one part of it. So right now, our three primary drivers, and I say there are primary drivers because as a work group, we have a whole lot of other, I don't want to call them secondary, but non-primary drivers, if you will, that are both very important and relevant to all of the work that we are doing. And they are definitely, that's a pretty long list right now. So we're definitely keeping an eye on those. But our three primary drivers, the first one is drug checking. And I say drug testing or drug checking, not testing supplies specifically. Last legislative session, there were some bills being passed around that were specific to fentanyl and fentanyl derivatives. But I will tell you right now, we have other issues than just fentanyl. So by broadening that perspective and broadening that language, we can be inclusive and change with the times. Unfortunately, I feel like by the time we meet back here next year, we'll be looking at something else, right? Xylozine's already on the market. We've got a lot of different contaminants, so we need to be able to roll with those as we move forward. The second one is updating patient brokering and anti-kickback laws in Texas. Spoiler alert, patient brokering is already illegal. I just want to let y'all know that. However, there's actually no official reporting mechanism in Texas. So what happens is a lot of our organizations on this work group, we get the phone calls from people, from case managers, from treatment and drug counselors, behavioral health technicians. This is the stuff that's happening, and yet there's no actual place for them to report it. And so that's a real big issue for us right now in our work group, as well as updating the language in that statute to be coherent with the 21st century. Like adding internet as a place you are not allowed to deceptively market. Just an example. And third and finally is funding for House Bill 299, which was passed last legislative session and created voluntary recovery housing accreditation in Texas. We're very grateful for Senator Johnson, Representative Murr, and Representative Wilson's work on that bill. It defined recovery housing in statute and did a lot of other very fun things. And I would say we are looking for a rider to fund that. Texas has funded other versions of recovery housing, and that has created a pretty big gap in quality recovery housing services. And we only want $4.3 million over the biennium, so we have micro budget dust that we are asking for. So we'll see. We're working with Senator Johnson's office right now to get that rider filed and ready to go in the budget, so hopefully, fingers and toes crossed, we can make some progress with that.
Thank you, Elizabeth. And I just want to stress how vital this committee is as well. When this group first started out, when I was first here, we really were just mental health. That's what we thought. And then as we realized just how vital co-occurring issues are, the importance of behavioral health as integrated into mental health and substance, it's really, really elevated until I really do think there is a par there for how our attention is focused. And then lastly, we have our consonant at the end of the table. We have Chris Bryant. She's with the Information and Technology and Infrastructure. It's a mouthful and a challenging committee, but here we go.
Good morning. I'm Chris Bryan, and I'm the Vice President of IT and Public Policy for Clarity in San Antonio. Clarity is a children-only psychiatric hospital, so while I serve on the Youth Committee, and it is a very fun committee, I have been working my IT hat in behavioral health, and you say to yourself, why do I care about information technology and behavioral health? And that is because there's very little of it. Just so you know, and I'm giving away some of my breakout today, unfortunately, physical health has been given a lot of funds from the federal level and the state level to do your electronic medical records and your patient portal and your patient apps, et cetera, and behavioral health is not included in that. And that's a very important thing, especially if we're sitting here talking about we need money for these items. We really need to look at efficiencies. We need to get up to speed to, at least, come on, 2005. Let's do that. What's really important about it, even more important, is I think everybody in this room knows that we are a very low margin reimbursement rate sector of the health community. Technology is expensive, and unfortunately, we may be doing duplicative efforts because we've got to do some for this and some for that and some manual, and we're doing a little of this and that. So we're going to talk today about how we got here and what we need to do. I do want to recognize Alexandra Cow. She's in the back. Again, where it's kind of the thing nobody talks about, it is very important, and I appreciate, she works in Senator Menendez's office, and they heard us clearly about 4 or 5 years ago, and we've been working on it, but we really, really, really need y'all's help to try to get some of this over the finish line. So we'll go into more of that detail later on today if you're in the technology session.
And I don't see how you all wouldn't be in that one. So we've got about 10 minutes left before the break, and I do want to make sure we have some audience questions. So I'm just going to start off with something pretty broad here for y'all. With other issues such as immigration, education, taxation, other ones possibly taking center stage, how do we really elevate behavioral health with the legislature? How do we really show that by putting investments into that space, it supports the well-being of our communities and our youth and our families and everyone? Please.
I can go for it. I'll do a quick one because I want everyone to answer if they do. But if you do or don't know, an institution is incredibly expensive for people. And more often than not, we want the least restrictive setting of care for people. If you're familiar with Olmstead, 1999 Supreme Court case, we want the least restrictive setting of care. And especially in the Texas Legislature, if you can make a case for this will cost you less money, you might have a better outcome. So especially with our continuity of care drivers, we really want to emphasize that this is actually going to not only cost less money, but result in better outcomes for these people that you've already invested a lot of resources in. So you might as well put your money towards continuity of care.
Yeah, very similar. I think we always want to give the argument that students deserve mental health support, right? Because we don't want them to reach a level of crisis. We always say it is a life or death issue. And so we really want to support students when they need to be supportive. Also, I think there's a lot of attention right now on school safety. And it's important to remember that what really makes students feel safe at school and in their communities is positive things like positive school climate, right? Getting the resources and the support that they need. But sometimes when you're talking to legislators, it's important for them to remember that it's also going to save them money, right? So as we support them at this level, they're not going to go to these higher levels of crisis that they'll need to be in facilities or interventions or in emergency care rooms and all these things that cost the state lots and lots of money. So we like to both give them the pitch that students deserve this because it's the right thing to do, and then also it's going to save you money.
Well, and I'll let you go, but I do want to say, again, if you remember where I work, a children-only psychiatric hospital, and we are incredibly busy and we are incredibly full on a daily basis, and if we could get all of this stuff done on the front end, maybe you guys could start putting us out of business, because really that's what we need to do. We need to get in front of everything. Yeah, sorry, go ahead.
Oh, no, just quick. I think what we hear from every legislator, regardless of what party they are, where they are in the state, is that they have constituents reach out to them that they are unable to access mental health or substance use care at any level. And a huge part of that is workforce. So that's why we can really make the case for why focusing on workforce at all levels matters.
I think, on the substance use perspective, really, I'm a person in long-term recovery also, and I will say that it was only when I engaged in recovery that I became employable. And I was able to, keep consistent housing and give money back into my community, buying a car, being able to afford my own groceries and, paying taxes and all those kinds of things as well. So, I think for us, we are up against so much discrimination, misinformation, and stigma. We could spend an entire lifetime just fighting that, but I don't really know what we would get done on the other end. So a lot of the work that we do right now is really focused on really using that kind of perspective. There is a cost savings when people engage in harm reduction and recovery support services, but unfortunately the cost savings is not upfront and blatant. It is in reduced recidivism, right? Like higher employment rates, more taxes being paid, things like that. So that's kind of a perspective that we tend to also take in the sub-work group.
Fantastic, thank you. And we are coming on time, so I want to make sure the audience comes in. Seth has a mic here. Do we have any questions from the audience? Is there anything you guys would like to ask this amazing panel? I see right here at one of the front tables.
Most of you are not old enough. Most of you are not old enough to know Phil Donahue, who did just recently pass away. This is my opportunity to be Phil Donahue. Nice to see you.
Doing a great job. So my question is, when we think about going to session and all the work that you do, and having to use the cost, to motivate people, what advice would you give for us in terms of self-care, right? Like, it's really draining as a person with lived experience to continue to go tell your story and then try to frame this through cost and these other things that don't feel all the time really at the heart of why you're doing the work. So I would just love to hear a little bit, since we're talking about mental health, how do we care for our mental health doing policy work?
Angela reminded me, when you go to the Capitol Grill, there's usually this like false wall that's pulled closed. You can go back there and cry. So just so you know.
I have a lot of crying spots.
You may find us there and we can hug and cry it out together. It's funny, but it's a thing. But I think as a person in recovery, that has happened to me 9 times out of 10. It rolls off. But that's also because I have really strong recovery supports that have nothing at all to do with my job. Right? Most of my friends have absolutely nothing to do with my work, and they know during the legislative session for 5 months I'm off doing something else, and they tighten their wagons. So it's on me to let them know. I need them to circle around. But it's that one time when it doesn't roll off and it is very personal and it's that gut punch out of nowhere. And I've gone into bathroom stalls and said the serenity prayer and taken deep breaths and tried not to throat punch somebody, But we all have that, right? And we are so close, I feel like, as a steering committee and a coalition, that I can call on my colleagues. We really lean on each other a lot. In all seriousness, to get through the legislative session. And every Friday during session we have a legislative update that everyone in the coalition is invited to. And honestly, man, there's been some times when we've just had some tears in that session. In that meeting, we had a week where so much amazing mental health legislation just got shredded, and that was a very tough Friday legislative meeting to get through, but we did. There were some tears, there were some other interesting comments made during that time, but this is what we do. We really lean on each other a lot.
I can add quickly, boundaries when you can. I think it's easier said than done because so much of this work is so personal to us that, this is for so-and-so, this is for myself, this bill directly impacts me, but you are one person and you can throw yourself at a wall over and over again. And we know that sometimes your effort isn't always indicative of your output, and that's not one person's fault. But having clear boundaries when you can. I play a lot of video games during session. Jen knows this because I feel really powerful. But and I think also leaning on your people. I think having lived experience testimony is the most powerful testimony you can have. However, you don't have to be the one person that crusades every time. So, tap people in. If you know someone with lived experience that has been going over and over again, check in on them, maybe take the reins for them, try to help them enforce boundaries or try to take some load off of them. That's my advice.
I want to jump in. Several of these folks know this just happened to me week before last, and I would say look for those people that inspire you. I've been struggling the last several months, exactly like you said, we're already getting indications that it's hard in children's mental health. We had a pretty rough hearing a couple weeks ago, and I happened to be at a lunch where ex-speaker Joe Strauss was at, and for those of you who don't know him, he really elevated mental health and the work that we do today, and I'm certain somehow his work will all come up in our different groups. But he asked me how things were going, and I told him not well, that we've been working, and I feel like maybe we're eroding and some of the work is sliding. And had lunch, and speakers are speaking, et cetera, and as I was walking out the door, he came over and he grabbed my arm and he looked right at me and he said, "You keep up that fight." And that was so powerful to me. And so I would say, hang around with those people that inspire you and remember why you're doing what you're doing, because it is hard and it's difficult, and some people don't realize how mean they are when they're talking to you about it. So find those people around you to lift you. I'm gonna do it for Joe.
And there was the part where you got in his car and he's like, "Could you get out of my car so I can leave?" You took it one step too far.
I know, but
That was not okay.
But to Elizabeth's point, I got right into my car and I texted all of them right away and said, "You cannot believe we're doing this."
I think we have time for one more question.
So being the last question, I think what comes up to mind for me as I hear, the wins and the struggles and the, all that you give, if there were one thing you could say to all of us in this room as to why you do this and to encourage us to get involved or support others getting involved, what would it be? Like, what's the reason? 32-second elevator, sort of, because of Joe,
I think because other people don't get paid to engage in this process, and it's important to try to be a voice for the people who can't take off work to go testify.
Yeah, I think youth just deserve it, and my favorite thing in the world is giving them access into spaces of power that they weren't originally invited, and they have the ideas, they have the innovation, they have the creativity to really fix some of the biggest issues we're seeing in our state, and if we just give them that access, I think so much magic can happen.
Staffers get tired of hearing from the same people, and so we need new voices in the Capitol.
I like all their answers, really. I would say that because recovery is possible, and most people don't really know that. And so the stronger our advocates are, the more we can all recover as a community.
yeah.
Do it for Joe.
Do it for Joe.
I think what you just heard is the strength of the leadership of the Coalition of Healthy Minds, and these are the amazing folks that you can join and you can partner with and who can help steer your advocacy there. Please give them a big round of applause for their panel.